I've met many mothers, with different experiences in labor. One of the cases was actually quite amazing. She actually never attended my antenatal class, and she went to a special class, and then she have a birth plan. And then she have her mindset is such that nothing she's going to use in labor. She's going to have a very natural labor. That's what she expect to happen. So unfortunately, she was not mentally prepared, and the skill, was knowledge was a little bit not so effective in coping with labor, and she was struggling for 76 hours. And then at the end, she ended up cesarean section. She was extremely disappointed with herself. The second story was about this mother. She actually, believed in her friend a lot. They share a lot. It's good to have support, but actually her water bag was broken. And then when she called the hospital, the staff asked her to come in. And she said to the nurse, no, I must not go in because my friend said the nurse will tie me down and starve me. So she delayed coming in. And then at the end, the end result was a little bit of a trauma for her. The last one, we always think that antenatal class is mentally prepared the mother, but we are also wrong. Father need to be prepared. So in my antenatal class, it's very important I must give them knowledge and then understanding and also some skill to pick up so that in labor, they're able to mentally know what to expect and what's happening, and they're able to stay calm and help the mother rather than become a hopping frogs. In this case, the father was so anxious, he's not mentally prepared. New parents often ask me about, delayed cord clamping and whether they can still store the cord blood. Both are usually done within 3 to 5 minutes upon the delivery of the baby, and the process for both is painless anyway. Through my years of understanding the entire delivery process and various types of birth plans which parents choose, I'm of the view that the benefits of delayed cord clamping are not as clinically supported as it seems to be. So delayed cord clamping first came about because to help premature baby to prevent anemia. This is usually done 25 seconds to 5 minutes, and usually most of the ONG will do that within that time frame. The WHO actually recommend at least 1 to 3 minutes. Do take note that there may be higher risk of jaundice in babies, and also postpartum hemorrhage for mothers when there is a delayed cord clamping. Our studies also show possibility there's maybe a transient rapid breathing and a delay absorption of the lungs fluid, we call it surfactant, due to the increase of the blood volume. There is always a misconception that baby who had delayed cord clamping cannot bank the cord blood or lining. This can be achieved through a very detailed discussion with your ONG doctor or trusted a well-accredited cord blood banking with immersed experience for the collection and processing of stem cells. I think it's very important because years of being a main speaker and a chairperson and also key speaker from the international seminars on stem cells, the clinical result has been very promising, and it has been proven to be able to use very successfully for 80 over diseases. And also there is a clinical test now showing that it's very useful for a lot of other neurological treatment as well, example like autism and also cerebral palsy. And I suggest that parents do this banking because cord blood banking, because it's your own medical resources. At the same time, it's very shameful to discard them. So I suggest, yes, please do that.